and allow me to welcome our first keynote speaker, Professor Sameh Jabbour. Professor Sameh is a cardiologist and a professor in the Faculty of Health Science at the American University of Beirut. I think I was introduced to Dr. Sameh 5 or 6 years ago when I was doing my master in epidemiology at London School of Artificial Medicine, and Professor Sameh was leading the AUB Lancet Commission on Syria. He was trying to expand and even build a network of researchers interested in the public health in Syria. And throughout the last few years, he was heavily involved in research related to health in Syria. But previously, he worked at the World Health Organization's Eastern Mediterranean Region Office in Cairo as a director of the Department of Non-Communicable Disease and Mental Health. And Dr. Jabbour earned his medical degree, his first medical degree from Aleppo University, which is, I think, a lot of participants came from Syrian universities in today's conference. But he got his master's degree in public health from Harvard School of Public Health, and he trained in internal medicine in Evanston Hospital, Northwestern University in cardiology, at Lone Cardiovascular Center and Women's Hospital at Harvard Medical School. So, Professor Sameh, the floor is yours. So, please.
Okay, thank you very much. First of all, a huge thanks to our friends Karim, Yazan, and others for inviting me to deliver this a few notes contextualizing Syria, contextualizing research on Syria for this conference, and it's wonderful to see so many friends online. So I hope this is a conversation rather than a very formal keynote speech. Let me try to share the screen if it works. Hopefully, does it work?
Yes, we can see your screen.
Okay, wonderful. I'm really impressed by how organized this conference is, as were the prior conferences, and this really has established a tradition, and has helped accumulate a record of health research on Syria. And what I'm going to try to do right now is to build on your work in the past two conferences and today's conference, to ask the question of what is it that we have learned from Syria over a decade of the conflict, and what's the work ahead of us? What's the agenda in front of us? I'm going to try to go into presentation mode. Swap. Abdulkarim, do you see my presentation mode?
Yes, we can.
Yeah.
See
okay. Wonderful. Okay. Great. In this case, I'm going to go to the next slide. So the big question that we ask ourselves today is that what is it that we have done, or what we could have done and we still have to do to research an atrocity-laden conflict, where, as Karim said, it's full of war crimes, crimes against humanity, committed largely by the Syrian regime, but also by some of the other parties, Daesh and others. You know, why we must learn is a really important topic. It is we are accountable as any party to the conflict, and we are a party to the conflict by researching the conflict, by interacting with conflict actors. We become part of the conflict ecosystem. So we must. It is part of our responsibility that we are accountable to what we are doing in our respective capacities. We contribute to the historical record So we give justice to the victims and to our colleagues who have fallen now, numbering almost 1,000 people, probably an underestimate, who have fallen to crimes in this conflict. And we also learn from what we've done to address gaps. And we ask a few questions. What have we done? What has been done over the past 10 years? What do we learn from what has been done? And what's the work ahead of us? In order to ask the question is that how do you study health in an atrocity-laden conflict? Perhaps we should look around and see what has been done in this region that has been in continuous conflict for pretty much the past 70 years, ever since the Nakba. And we don't need to look any further. We look at the institution where I work that has lived through a long civil war, and to see what kind of output has come up, to see if it can guide our thinking about research for Syria. And the striking aspect is that if you look at these seminal books, look at just the table of contents, that you will find that there is some basic epidemiological thinking, even some attention to health system issues, but the war and conflict is not engaged as an analytical topic, this leads you to search further around the region and to discover that actually, while there is indigenous knowledge that has accumulated on the subject of war, conflict, and health, whether it's in development of triage protocols for people in mass atrocity events, surgical techniques to address bad injuries, or public health programming, there is indigenous knowledge. It's just that indigenous knowledge has not translated into institutional building, and has not translated into theorizing about the conflict. And I must emphasize that this is not a luxurious term. Every time we research, whether we acknowledge it or not, we theorize and we present frameworks, whether they are explicit or implicit, they are there, part of what we are doing. So let us look forward then, look to the world, look broader than our region, to ask, well, how have other regions affected by conflict and wars? I studied war, and you discovered that actually there's a similar problem. A lot of regions where wars and conflict are really endemic. Sub-Saharan Africa, even some countries in Asia, haven't produced the kind of guidance to tell us how we proceed. So we look globally and we find some of these seminal books, but when you open the table of contents again, you don't find what would guide you to study your own situation as you know it. For example, none of these 4 seminal books that you see on the screen have any chapters related to attacks on health facilities and targeting of health workers as a strategy of war, as a topic that has been a defining feature of the conflict in Syria. So then you come to the conclusion that well, there seems to be really a a need for new indigenous knowledge, new approaches, new frameworks to understand our realities, understand health in the Syrian conflict. And in the Commission on Syria, we've proposed this framework whereby you look at several dimensions, where you analyze the conflict ecosystem, you document the toll of war, you scope the response to the conflict at the various dimensions. Obviously, we're not doing the latter two, but they are part of any study of war conflict, where you're also developing and testing interventions, and also planning ahead and designing for system change. Many of our colleagues in the conference today are doing work across this framework. Let me start from the bottom. Planning ahead and system change. This is essentially what R4H SSS that Abdul Karim is leading is doing. Developing and testing interventions. This is what a lot of our colleagues who are working in Northeast Syria are doing, whether these are bread and butter public health interventions or innovations. Now, how do we understand how well we've done in covering this ambitious framework in a decade of research on this Syria conflict? Well, we have to be a bit methodic and systematic in how we approach this. So we've looked into research and Syria. If you put, for example, PubMed search with those terms, you'll find, unfortunately, only a limited number of publications. I highlight some of these publications. Adam colleagues in 2015 have argued for the need for data and research. Abd Karim and colleagues have argued for collaboration and partnerships. Now, while Yazan and colleagues have looked into a specific research experience. This is just examining the research enterprise and making the case for the importance of research. But it doesn't quite cover the various dimensions of the framework. It doesn't tell you how well is one or three or four covered, or the specific topic covered. So, our colleagues Rima Abdel Khalid and Marianne Abu Zaid have done some work examining exactly research over the conflict. Over the years of the conflict, to see what kind of publications. This is a graph that shows that there has been a growth of publications on health and the Syrian conflict, but a lot of those publications, as you can see from Table 1, are actually covering are actually more on news, editorials, letters, and stuff like that. The research has been has grown, but a lot of it does not cover health inside Syria, but rather the health of refugees, of which we all know that there is a huge volume of research. These are the topics that have been covered. So there's a growth of research, particularly on health systems, which is a welcome in development. Marianne Abu Zaid and her colleagues decided to focus on examining the growth of research specifically on health inside Syria, because this is really has been the major knowledge gap over the past 10 years as compared with the refugee search. And you see that there has been important work, but again you see that the coverage is rather patchy. And when you look at it by the coverage of the governors in Syria, you find that there are a lot of gaps as well. And obviously, you see gaps in various themes as well. And I think the heat map itself tells you a story about our agenda going forward. Let us. We don't have the time to go through all aspects, but let us just focus on one example, which is the analyzing the conflict ecosystem. Let me emphasize from a health perspective. Obviously, we are not conflict analysts; we are health researchers. So, how have we employed conflict analysis in our health work? And this subject is really critical because today we are facing a narrative war whereby there is a rewriting as efforts towards normalization with the Syrian regime are proceeding. There are efforts. They haven't made it yet to the health sciences, but they are out there in social media, in popular media, and it's actually, you see it even in academic journals, particularly in political sciences and others. Our colleagues, who's a genocide researcher, Unger, has warned about the narrative war that is coming, and this is part of what I referred to earlier. Our responsibility is to really uphold the truth and protect the record. Protect the ideals of the revolution and protect the sacrifices that have been made. Now, those particular ideals and revolutions, unfortunately, haven't made it to be part of the conflict health and conflict research on Syria. When I asked one of my colleagues in one of the major humanitarian organizations in Syria, but why do we not talk about revolution and all of that, and just stay within the safer realms of talking about attacks on health facilities and the need to protect humanitarian aid, essentially depoliticizing health and humanitarian actors, depoliticizing why we have got involved in this work to start with. The issue is that we have to be we have to be neutral, and we have to protect flow of humanitarian aid. But one of the perhaps most prolific and impactful humanitarian researcher, Hugo Slim, argued that you don't have to be neutral to be a good humanitarian. And this is an example of the need for us to really develop a conflict narrative 10 years after the outbreak of the revolution, in order to protect that narrative and preserve it for posterity, and give justice as well as credit to the colleagues who have endured unspeakable sacrifices and crimes in the past 10 years in order to deliver health in areas such as northeast Syria. Another example is that is the issue of how are we incorporating health conflict analysis, data on conflict events, for example, conflict analysis in our health research. And there actually is now a plethora of organizations that have accumulated a massive record of conflict data and conflict events that health research has only tapped to in a very limited way. And some of those organizations are Syrian-led, Operations Policy Center, Markaz Harmoun, Al-Jamhuriya Group, which does more of a kind of a qualitative analysis. So we have an opportunity, and that's part of our agenda going forward. We also have an opportunity to contribute, as a matter of fact, perhaps an obligation to advance theoretical thinking on conflict and health. This is work from Madeleine Hicks, really leading work that hasn't yet been advanced as much about proposing two indices, two frameworks for applying conflict analysis, incorporating conflict analysis in health research. The first is called the Dirty War Index. Whereby you track certain indices to indicators in order to present conflicts for a public health audience, so that the conflict itself becomes an analytical dimension rather than a background to talking about health systems and health status and whatnot. The second paper that Madeleine also led proposed something called the Civilian Targeting Index. I mean, this has been again a defining both the dirty war and the civilian targeting are both key dimensions of the Syrian conflict. And perhaps we have an opportunity to advance the work that Madeleine and her colleagues have put in front of us. There are recent works on Syria that I encourage you to read. Leila Vignal wrote an important book that was just published in the past couple of months about examining a 10-year examination of the conflict through empirical research that I encourage you to read. Jihan Psiso and colleagues, including Ola Abbara and her colleagues, I think Manal and Hala have contributed to this edited volume on the politics of aid in the Syria conflict. Abdkarim Aziz and Ammar Sabuni, Hakim Khaldi, and others have contributed to this volume, which I think is only yet in French, although some of the papers are published in English, on examining health through the MSF experience from in situations of extreme violence, in which Syria is just one component. So, but even this work still, if you go back to the framework, you will still find it only addresses some part of the agenda that we need to cover in order to say that we have really been able to cover a lot of what's in that framework. Now, this work really requires the type of collective endeavor that Abdkarim referred to earlier. A couple of years ago, many of us exchanged an idea of actually building an actual consortium in order to bring various groups together and do this. Now, I respect Dima Azzeddin a lot. She's a dissident journalist who's done important work for Syria. Dima has argued that Syrians are not good yet at collective work. For those of you who do not read Arabic, this is what the caption is. But, you know, I will respectfully disagree. I think health researchers from Syria and who are working on Syria, who are non-Syrians, we're all equal in this, have proven that no, we are capable of doing collective work. And the record of the past 10 years showed that there has been important collaborative efforts. We now need to build on this to advance our agenda. What is this agenda? The first is to really come together even more strongly than we have done to build a community of not just practice of people who are interested in health and the Syria conflict, but a community of purpose, who are a community committed to preserving the historical record, giving justice and credit to people who have who have made the contributions and made the sacrifices. Through doing that, we are also and advancing the research. We are also joining and shaping a global movement that sees health as central to work on conflict and health. And by virtue of doing so, we are also advancing the science, the field of war, conflict, and health. This agenda is what would ensure that we are able to make a contribution as health researchers, and researchers who are interested in health do not necessarily need to be health researchers. That this ensures that we are